My father was an orthopedic surgeon. My mother was at home and raised me and my two siblings. And growing up, I noticed that my dad loved his job, and I thought I wanted to do that. And I thought if I could take care of patients like my father and take care of people like my mother, then that would be a pretty good combination. So that's how I ended up in pediatric orthopedics. My interests are in pediatric lower extremity conditions, specifically hip and foot and ankle conditions. The two things that kind of excite me most is how we continue to treat hip dysplasia and club feet. I think both are conditions that can affect a patient from shortly after birth through their adolescence and early adulthood. The pediatric orthopedic surgeons at Washington University are all trained in not just providing the surgical or clinical treatment necessary, but they also have an additional understanding of where that child is developmentally, where they are socially in their development. All that factors in a great deal when you're treating a child, whether that child 2 weeks old or 18 years old. I always ask the patient, what do they do for fun? What sports do they play? What's coming up on their social calendar or academic calendar that's important to them? Because all of that factors into how I'm going to treat the patient. I was privileged to be a resident in the Department of Orthopedics at Washington University and St. Louis Children's Hospital, Barnes Jewish Hospital. And so I got a very detailed glimpse into what kind of care that we offer here. And not just the breadth of care, but the expertise and the high level of care. And when I went away for fellowship for a year, I knew that I wanted to come back here and practice with partners who were my previous mentors, who I highly respect. It's not just that we have extremely highly trained, highly skilled surgeons and physicians at St. Louis Children's Hospital and Washington University, but we have the state-of-the-art imaging modalities, research resources, treatment resources that not every place can offer.